We do this segment on Thursday morning. We call it What's Up, Doc, with our friends from Mercy Health. Well, in this case, it's What's Up, Certified Nurse Midwife.
Yes.
It's a longer title, but it's very applicable this morning because you're about to meet one, and that's Amber Latsch. Amber, good morning to you.
Hi, good morning.
How you doing this morning?
Great, how are you?
We have nothing to complain about, right?
No, we do not.
No, it's a decent-looking day. We're on the cusp of a holiday weekend, so yeah, everything's pretty good right now. For people who are unfamiliar, now I must admit a certain amount of unfamiliarity about certified nurse midwives. I did learn that there's about 15,000 of them nationwide at this point.
Sure are, yeah.
Growing in popularity, but still largely, I don't know if it misunderstood is the word, but people...
misunderstood is the word.
Is it?
Well, just so you know, Amber, who you're dealing with here, Riley with two children, has been through the childbirth process. Not himself, but he's...
I witnessed it. Let's put it that, and caused it.
He's been witness. Myself without children, wildly ignorant when it comes to childbirth and what goes into it. So that's who you're talking to today.
But with some blanks to fill in here,
yes.
And we'd like to educate people and ourselves at the same time and learn a little bit more about you, Amber, and what it is you do. So, but break it down. What is a midwife?
Sure. So I'm a nurse midwife, and there are a lot of different types of midwives, but here at Mercy Health, we have a group of certified nurse midwives who basically, we work very closely with our OBGYN physicians, and I think OBGYNs are what most people are familiar with in terms of who's with you when you have a baby, who helps you have a baby, who do you see for your pap smears, things like that.
Right.
And so we do essentially a lot of the same things, but we have a very different kind of mindset going into it. So we see pregnancy as a normal part of life. We, try to help women through everything with, if their intention a lot of times is to avoid some interventions, maybe they're looking for a more natural birth experience, something like that. And we also have, many women who are like, nope, give me that epidural, and that's totally fine. We do that too. But, we really are more kind of the experts in normal birth, whereas our physician partners, they are experts in complications. So they are wonderful, and we work really closely with them for any of our patients that have, the need for a C-section, for example, or if we say, hey, this isn't normal anymore, we call them up, and they, kind of come right in and can help us get, whatever level of care that mom needs.
When do you usually come into the picture during a pregnancy?
Sure. So we see not only pregnant women, but also just women for regular women's health care, checkups, birth control, things like that. So sometimes I've, known this woman before for non-pregnancy related things, and now she's pregnant and she's coming to me. Other times, they will essentially call our office and say, hey, I'm pregnant. I want to see a midwife. And then they come and see us throughout the whole pregnancy.
Outstanding. Now, I was going to say, not every woman is a candidate for the services of a midwife, or
Right.
Are they?
So most women, who are healthy, for example, don't have chronic health problems like high blood pressure or diabetes. Those are women who, generally midwives will serve. And then there are other women who are going to be better cared for under one of our physician partners. So, for example, women that have had C-sections previously, that's another one that we would refer to the OBs. But otherwise, most women, who are generally healthy can be under the midwife service.
Okay, because I was thinking about our circumstance with both of our children. Both resulted in emergency C-sections when things got very, very dicey.
Yeah.
So had you been in attendance as this all began, when things began to take a turn for the South, and they both most certainly did, that's when a call for extra help comes in, correct?
Exactly, yes. And so we have a couple of different resources available to us. So at Mercy Health, we do have in-house OBGYNs 24/7. So it's really nice that if I'm starting to get concerned, and it's not like we are... very far away from these doctors. So
Right.
We're generally talking with them throughout the process if there's something going on like that. Or if, like you said, sometimes things can very quickly turn concerning, and we do have to do something emergently. So it's nice that we can just, send them a page and they're in the room with us within minutes. So it really doesn't delay anything in terms of emergency care. And we work really well with them. They're all great. They're very supportive of our practice and, are there and very willing to help us if the need arises.
This is going to be hopefully not too long of a rambling question for you.
Go ahead. We have time.
We do have time. And also, I remember this comes from a place of extreme ignorance about pregnancy and just women in general. Just put that out.
I haven't had the talk with Joe yet, Amber.
In my life, whenever I heard midwife before, it kind of it was a bygone era. Something we did before we had these medical expertise that we have today. Am I right in thinking that was something of a bygone era? Is that what a midwife used to be? Has the definition of a midwife, changed in the last couple of decades?
Sure. So midwifery has definitely evolved over time. And, I think it's very common what you're describing, thinking that midwives are something we sort of used to have, but now we have these great things called hospitals and we don't need that anymore. And so what our role really is to try to kind of protect normal birth. So a lot of things that we do in the U.S. especially, we've shown that we do more things in terms of technology, we spend more money, things like that, but it doesn't necessarily, and often it actually gives us worse outcomes. So it doesn't necessarily mean that we have healthier moms and babies. So one of our roles is to try and obviously, first and foremost, give our patients a healthy birth experience where mom and baby are doing well. But sometimes we try to kind of take a step back and say, do we really need all of these machines? Do we need everything here in order to get that outcome? And the answer is that for healthy women, a lot of times we don't. And so, yes, it is sometimes kind of taking it back to more original, midwife kind of practices of let's just let this woman's body work and we'll be here if there's a problem. But other times, and like I mentioned, just because that's kind of our area of expertise doesn't mean we don't see women who have no interest in that whatsoever. And like I said, they want, give me the epidural and I want to be induced and all that stuff. So we certainly can help with that as well. So, I think it's a nice blend of more traditional midwife practices, but also current obstetric care and, trying to just practice what's going to be the most evidence-based thing to do for this mom.
If you're just joining us, we're spending some time with Amber Latsch. She's a certified nurse midwife with Mercy Health and nice enough to put up with us and get some questions answered here. Yeah, I
taught us a new word.
Midwifery.
Midwifery.
I didn't know. I would have called it midwifery and then been feeling stupid about things.
And real quick, what's the plural of midwife?
Midwives.
With a V?
With a V,
okay,
yeah.
want to make sure.
Okay, well, you're taking copious amounts of notes over here.
Thank you.
I think back to my own parents' birth, both of them born in the 1920s. My father was born in the same bed that his mother was born in, and was born at 2 pounds and was put into a shoebox that they slipped into the oven on a low setting as an incubator.
Oh.
And I think back at that time, who delivered him? Well, my great grandmother was part of it, and then there was another woman who they, I guess, in italics would call a midwife, and that was just a woman who'd had 12 children and was very, very familiar with the entire process, and she was there to oversee all of these things.
Sure.
It's a wonder that anybody survived back then.
Sometimes it is, yes.
I just, wow, yeah, born at home, we go to a hospital. Why would you go to a hospital? We're having a baby. That's not what a hospital is for.
Yeah.
And for people who have that archaic sense that title ties in with that bygone era, you pretty well dispatched all those notions. Your certification, your training is really, really extensive, isn't it?
Yeah, so for our practice here, like I said, we have certified nurse midwives, and so what that really means is that we were nurses first, so we went through traditional training that an RN goes through. All of us here, were experienced labor and delivery nurses and then became nurse midwives, so that's a master's degree in nursing. So usually I think people are more familiar with the term like nurse practitioners or NPs, and so that's essentially what we are, but focused on women's health and pregnancy and childbirth.
Has COVID-19 changed the way that you deal with your patients?
It has a little bit. So we have, more restrictions in place in terms of our clinic visits and, deliveries and visitor restrictions, things like that. We're all wearing masks and hopefully, we try to make it still feel personable because this is such an intimate experience for our patients. And so it can be really hard for them to, not be able to share some of these experiences with their partners or their families or whoever. But we're trying to do everything we can to still, include partners and, whoever the mom wants to include virtually if we need to. We're also offering more telehealth visits, so I've done quite a few prenatal and postpartum visits and even just regular gynecologic conversations over telehealth, so that's been nice as well.
This is going to be an odd question, but enough of us have seen this in the older movies and older TV shows. When a woman goes into labor, why was it always they would look at the man and tell him to go boil water and tear some sheets?
Well, the boiling water is usually to sterilize, for example, like a scissors, perhaps to cut the cord. Tearing sheets, that could be used for pads. Some women used to actually bite on them for pain relief. And you can use that to tie the cord off. So, if you ever have to deliver a baby out in the wilderness, then you got bed sheets with you.
See, my grandmother said the reason for that was to get the men the hell out of the room.
I think that's the real reason.
I mean, that's a very equally important thing to do sometimes.
Amber, how do people go about making an appointment with you?
So if people call our regular Mercy Health phone number, so it's 815-971-2000, and if they just say that they want to make an appointment with one of the midwives, then they'll direct us to our office and they can get set up for an appointment.
You sound like you would be an absolute joy to have around at a time like that. You made a wonderful impression on me. I'm going to go home and talk to my wife about child number 3 right now.
Good luck, dude.
Yeah, I'm going to need a lot of luck. Amber, thank you so much for your time. Thanks for what you do. I hope you have a great, happy, and safe weekend.
Thanks. You guys too.
We appreciate it. That's Amber Latsch, certified nurse midwife with Mercy Health.